Hello everyone, in this video we are going to discuss about CURB-65 score. So what is this CURB-65 score? It is used in the assessment of the community acquired pneumonia severity and to decide whether the patient requires hospital admission or not in cases of emergency settings. So what is community acquired pneumonia? It is an acute infection of the lung parenchyma acquired outside the settings of hospital settings. Most commonly caused by the streptococcus pneumoniae. So we use this CURB-65 score to assess the severity of this pneumonia. So C stands for confusion, that is new onset disorientation to time, place, person, and on abbreviated mental test, that is abbreviated mental test or cognitive function test, which is a rapid quick screening tool. If the score is less than 8/10, then it is known as confusion. Next is urea levels, blood urea nitrogen levels more than 7 millimoles per liter or 20 milligrams per deciliter, and respiratory rate more than 30 breaths per minute, and blood pressure levels, if systolic is less than or equal to 90 millimeters of mercury or diastolic less than or equal to 60 millimeters of mercury. Age more than or equal to 65 years. For each of this, one score is given. So cumulative score, if it is 0 to 1, it is low risk. Outpatient treatment is only needed, and if the patient is having the score of 2, it is moderate risk. So patient may need inpatient stay or closely supervised outpatient stay. Next, if the score is between 3 to 5, it is a high risk. So hospitalization is required, especially ICU settings may be required if the score is more than or equal to 4. So the main drawback of this CURB-65 is it is used in emergency settings. Oxygen saturation is not taken into consideration in this CURB-65 score. So let us see a clinical scenario. A 72-year-old man presents to emergency department with fever, productive cough, shortness of breath for 3 days. He is confused, disoriented to time and place. So the score will be 1 here, and the patient's respiratory rate is 32 breaths per minute. If more than 30 breaths per minute, we will give a score of 1. Blood pressure 88/55. So less than 90, less than 60. So it is 1. Blood urea nitrogen 25 milligrams per deciliter. It is more than 20. So it is 1, score 1. Oxygen saturation we don't take into consideration in CURB-65. Temperature is also not taken into consideration. So the CURB-65 score will be 5. So the patient will need an inpatient hospitalization. ICU settings is needed. So the CURB-65 score is 65. The management recommended is hospitalization with ICU settings, since the score is more than 4 and the patient is having very high risk. So this is the CURB-65 score and its importance.